do I start?
Yes, you can.
Okay, yay. So I want to welcome you all to today's live stream. And first, shout out to my husband, Richard, who is on the same level as me today. You guys now know my decor in my home. And it's really great because, and most appropriate, in that Richard's always been the person to be there to catch me at any time and any point. So whether it be internet or otherwise. So he's nearby in case we have any issues, and because he's the one who fixes them all. So thanks again, Richard.
Well, thank you, Margaret.
Wait, I want to do a yay out first to all of you. Sorry, hon. For first of all, finding Miller Guide as a resource to help you with your bones. And that's what today's live stream is all about, is to address the many questions. I think Richard's telling me we were at 300. I just want to commend you all for putting out your questions there and making time today to be part of this live stream. And so many of your questions, we are going to group them a little bit because none of your questions are totally repetitive, but I can categorize them. So we will do that for some of your questions. You'll see that happen. Otherwise, if your question was rather unique, then it might come up as the question the way you asked it. But we do really appreciate all of your questions, and it really helps us when we're planning our year and thinking, what do we need to provide people with in terms of information? So your questions does shed light on what information is still lacking out there, and we will do our best to fill in the gaps for you. So, okay, over to you. Thanks, honey.
All right, so thanks, Margaret. I'll actually just start with the required disclaimer, so you understand. I'll read it out, just take a moment. And if I can get it here, this live stream and its contents do not constitute medical advice. It is for information purposes only. If you have a medical condition, you should consult with your physician or another licensed healthcare professional. So with that, I think we can kind of move to things. Margaret mentioned we have a lot of questions. We had about 300 come in. Margaret, which topical area do you want to start with today?
Having given it a lot of thought, there wasn't a ton of questions in this area, but it's so very important, and we've never done a live stream on vertebral compression fractures. So that is where I'd like to start.
Okay, so first...
Can I say why I want to start there?
Please.
Is that okay? Is that with all the other questions, when we leave this category on vertebral compression fractures, I want you to know that this is what's always top of mind for me when I'm making suggestions or trying to guide you to safe but effective exercises, is keeping you safe, first and foremost. I don't know your history. I don't know how fragile your bones are. I don't know the quality of your nutritional intake in terms of the support your bones have had over the years, your exercise history. There's so many things that impact our bones, genetics, just vitamin D, just so many things. So when you receive my answer to your question, or a question you've been thinking about, then please keep that in mind, that I'm not looking at the outside of you. And I know so many of you go, but I'm so strong and I could run so fast and I can lift so heavy. That is not an indication of your bone health. And so let's start with vertebral compression fractures, because these individuals were really brave at sharing their stories. And unfortunately, their bone quality, which is expressed through their vertebral compression fractures, is not great. So we do need to keep them safe.
Okay, so I'll start. Many of you with multiple compression fractures have reached out regarding pain, muscle spasm, trouble taking breath. Okay, so first question is, what should I do to reduce symptoms? Will bracing help? And is pain a warning or normal part of the recovery process for vertebral compression fractures?
So that was a synopsis of several questions, because every single one of you is going to be different. Half of the compression fractures that happen fortunately without pain, or the pain episode is of a duration 6 to 8 weeks at the most. For a lot of these individuals, they will have sort of a gradual subsiding pain, and they'll go, I guess it was nothing, but it was something. It's just they don't realize it was something. But for those of you who are still having pain 8 weeks, 10 weeks, 10 months later, then you need to look beyond your bones. The compression fracture, certainly, I'm going to play it safe and say 4 months out, if there's been no new insult to the vertebral body, the vertebral body will have shrunk a little bit and it will have healed in that new shape. But all of the little muscles around that vertebral body have to adapt. And we have muscles, attaching. If you all feel the back of your neck and you can feel the bones of the back of your neck, we have these spinous processes, that's the back of your vertebrae. We have these going all the way down through the 12 thoracic, the 5 lumbar, the 7 cervical. And then not only do we have little muscles attaching each of those, but we have little muscles attaching from the spinous process to the little wings called the transverse process. And so it's like if I had little muscles attaching from my ears to my hands on each side, and then from one hand to the next hand lower down of the next vertebral body and the next one, all of those muscles can get pretty pissed off from the new height, from the restriction that they've been under, from the local inflammation that they've been experiencing. All of that can give you pain, and it will give you pain right on your spine. Now, it will also refer pain, sometimes all the way to the front of your body. In the lower back, it will refer pain down into your buttock, down into the hips. It is not at all unusual. So I'm going to pick up a great reference book that was written as a self-help book for individuals, but it has been a great help book for me as a physical therapist over the years, and I wish I'd learned this when I graduated 39 years ago, but at least it's been a really good companion for the last 15, 20 years. It's called the Trigger Point Therapy Workbook, 3rd edition. Clara Davies and his daughter Amber Davies. Clara has since passed away, but it is written to help the layperson. So don't feel intimidated by it. It will have hash marks where it is saying, if you have pain here, go and check out this muscle. So it'll have a section on back, and by all means, it will, you can start feeling it yourself if you can with your hands. Go, oh my gosh, that muscle is so tender. How much of your pain is coming from that muscle? We don't know until that muscle gets treated. Claire and Amber, they do provide great guidelines in terms of self-treatment, using little balls, using Theracanes, back knobbers. These are devices that are available on Amazon, and they even suggest exactly the type of ball, the size of ball. So please don't give up on pain management or pain control until you or a skilled massage therapist or some chiropractors are great at really assessing the deep muscles of the spine. So are some physical therapists. If you do see either physical therapist or chiropractor, absolutely no manipulations should be done on your spine. So no fast thrusts on your spine, but gentle mobilizations where they are literally just bending a bee's knees. That's the amount of force that they should be doing on your spine to just regain some gentle mobility in there. So that is my answer for that question. Sorry. Try to keep them shorter. I'm just looking down.
Okay, well, I'll go to the next question, and I'll stay within the compression fracture category. There was a few questions you wanted to delve into, which I will do right now. So I'm a 73-year-old male and continue to fracture vertebrae with no obvious reason. Currently dealing with 12 fractures of the lumbar and thoracic spine. Is there anything I can do to stop this from happening?
So first I want to say I'm very sorry for your condition. At this point, I want to say, I guess the only positive thing, if you're at 12, you don't have too many more compressions to happen, but they are likely going to happen. And I say that because it's an exponential increase. You know, after you have one, it increases your risk. If you have two or more, it increases your risk, I think, to the point of 75% more than not having your first one. However, you can stop the ones that you have from getting worse. And the most proven thing to stop that is to strengthen your paraspinal muscles, the deep spinal muscles along your back. And I know many of you in the questions have said, what can I do other than the Flora M exercise, the cobra-like exercise where your pelvis stays supported on a pillow and your feet stay grounded and you're lifting your torso just off the floor, not as high as a 4-month-old would do when they're building their back muscles to be able to be vertical human beings, but just enough that you're activating those back muscles. But if you're unable to do that, you could certainly start up against a wall. But most importantly, what you could do all day long is sit as tall as you can and stand as tall as you can. Because just by sitting and standing tall, you are activating those muscles. So you don't have to always do a special exercise, but just start to activate those muscles throughout the day. If you get fatigued from sitting and standing tall, try to avoid going into a slouch, but rather rest your back in a safe position and then try again. And you will gradually build up the endurance and strength in your paravertebral muscles. The next thing to do is to be super cautious about just how you move throughout the day. And so if you have not gone through my vertebral compression fracture course, I have a ton of information in there, probably more than you care to look at, but where I just try to cover as much as I can, questions that have come in, clients that I've had that have helped me learn in this domain to go, what are the things that you guys need to know about to live safely with the compression fractures. So I hope that helps.
Sorry, I'm back there. I had someone ask a question about the trigger point therapy, and I found it on Amazon for them, so it's up on the chat there for people. Next question. Okay, is it, again, this is where we stay within the theme of compression fractures, is it safe to do the straight leg raise from your wonderful book, Exercise for Better Bones, if you have multiple compression fractures? Thank you for all your wonderful work.
So I don't have the name straight leg raise in my book. I have a sideline hip abductor strength exercise. I have a hamstring stretch that looks like a straight leg raise. So if you do them just as described, they're totally safe. If you Google straight leg raise, or actually better that you go to my YouTube channel and you put in straight leg raise, it is a common exercise that is given to people to strengthen their quadriceps, and it will strengthen your hip flexors as well. But it's really common that we give it to individuals after knee replacements, hip replacements, and the modification that I mentioned in the YouTube channel is to, rather than starting from the ground up, which is tough on your low back if your abdominals aren't really tight, is to start from a pillow so that you have less gravitational pull on your hip flexors, or the demand on your hip flexors, which will pull less on your back. And always keep the contralateral leg bent and the knee bent and foot on the floor as close to you as possible to help support your spine.
Great. Margaret, did you want me to walk through some of the resources available to people that you mentioned in terms of just our YouTube channel, or we do that a bit later when you need a break?
Yeah, maybe a little bit later. Thanks.
Okay, well, so let me know. Okay, so we'll go to the next question. If I have a vertebral fracture, am I still supposed to use heavy weights as long as I have good alignment? I can't seem to get this question answered by anyone.
Okay, so I have clients with compression fractures, and they lift heavy weights, but I know about their fracture. I know, it's 20%, 30%. It's been, it's chronic, meaning that it's been the same for, months and years. I know that they understand what I need them to do in terms of posture and alignment. They know the risks involved in lifting heavy. They work out in front of a mirror. They make sure their form is good. So with those individuals, I have no problem whatsoever. When it comes to heavy lifting, as in the Lift More program, where it's at 80 to 85% of your max, which means that you are fatiguing within 5 reps and doing multiple sets, then just as Belinda Beck, who was the key author of this study, says you have to do this under the guidance of a trainer. And this is absolutely paramount. And I had a conversation with a client this week, and I was saying it's just too much risk if you're fatigued, if your game's not on, you're not totally focused on the lift. If you go down in a deadlift, for instance, and you take the arch of your back, and in a deadlift you're going down, you're maintaining this arch all the while, then this is safe. But if you go down and you're thinking, well, what am I having for lunch? And your trainer is not looking at you at the time, and you flatten your back and you have X amount of weight on you at that time, then it's a big problem. Like, it could literally be what breaks your back. So I wouldn't take that chance. Me personally. So, so you can lift within reason with fatiguing between 8 and 10 reps, which is, where, I upgraded my program a few years ago. One of the questions that came in was, has there been any updates in the book? And we did it through the exercise schedules, in that I went from recommending 10 to 12 repetitions to 8 to 10 repetitions after Belinda's studies came out, because I went, okay, we have permission to lift heavier. I'm just not comfortable encouraging people to lift to the level that they absolutely need a trainer. Most people can't afford one, and I wouldn't trust most trainers out there, just because they're human as well, and they're absent-minded, and especially today with phones. And if you're more than one, if they're not one-on-one, then their eyes aren't always on you at the time that they need to be. So, okay, that's my long answer to that question.
I was wondering, could we switch on to another topic and
Yes.
switch gears here,
Yeah.
because there are a lot of topics. So we'll go to the next theme, and we had quite a few questions about different activities. So certainly certain sports that involve rotation, and are they safe for individuals with osteoporosis? So again, just rotational movement, and specifically the questions came up around, and I guess it's the time of year, paddleboard, stand-up paddleboard, kayaking, and golf. And also, well, we'll start with that, and then I think we'll go to the next subtopic associated with activities. Okay, so I'll pass it back to you, Margaret.
So someone's hamstring flexibility does dictate certainly the rotation available in kayaking. It's not such a big deal when it comes to, and I'm going to back up a little bit here, but when it comes to a stand-up paddleboard, you can certainly, do a lot of the flexion. The rotation hopefully will come from your hip joint. So if you are wondering, oh, is my rotation coming from my hip? Then just simply, can you rotate pelvic girdle and shoulder girdle simultaneously? And you go, okay, that's it for right now. And then I'm feeling it coming through my hips. So I'm like, okay, I don't have any more. Then I'm going to change, and I'm going to come out here. I'm going to change the position of my feet, so that if I know I'm paddling to my right, then if I externally rotate or place my foot out here, then I have a lot more range that I can access. So I can access all this range from my hip, in my hip, because I have lots of external rotation. If you're an individual with lots of internal rotation, you can play with that and allow yourself to play within that range that you have in your hips. We all have different ranges throughout our body. So trying to get the rotation to happen from joints that are safer to rotate from would be one. Hamstring flexibility, I mentioned when it comes to kayaking, because as we go down, if we're sitting in a kayak and so I didn't bring this little cushion, and so if we're sitting and if we have tight hamstrings, then the hamstrings are pulling so much, because a lot of the kayaks, your legs are just about straight. If they're totally straight, because they're pulling on your sit bones, they're going to flatten your back. And so a couple of my clients have gotten adventure, I think they're adventure kayaks, where they actually have a seat built in, and the seat places them almost in just this little posture, which allows them to have a better lumbar lordosis. So that's quite good. And when it comes to golf, I am going to say that we know that golfers will always have more arthritic changes on one side of their spine than the other. You can certainly, I do have one YouTube video on golf where you can take your club, look at your posture at address, and make sure that you're hitting with all of your shots with good posture at address. I encourage my golfers to not be the one hitting off the tee, that they just play best ball and start from there. Because with the shorter strokes, then you can limit your rotation and not be so wound up in through your thoracic spine. And yeah, so those are some key tips. And with all sports, if you already have a compression fracture, as I mentioned earlier, then your risk of another compression fracture is really high. So you have to really give it some thought and go, how much is it worth it? And if it's worth it a ton for you, then go for it, because it's all about quality of life and doing the things you enjoy doing, but you're taking the risk. But hey, we take risks all the time, and so just knowing that it's a calculated risk. And so, all right, those are my comments.
Okay. If you don't mind, can we move to yoga? There's a lot of yoga questions.
Okay.
Okay. Well, let's actually, this is for I'll go to yoga next. How about TV viewing chair options? You want to talk about sitting in a chair? Because there are several questions about that activity.
Yeah, wouldn't quite, I guess it's an activity. This is where my kids laughed when I said, I got new chairs for Christmas so that everybody have somewhere to sit. And so this is from Margaret McGuire, who had suggested this, or found it in her house, and went, oh, this is awesome. And anyways, so this is awesome. If you do have tight ankles, you can place a little roll underneath the front of your ankles. The gray chair behind me is where Richard used to sit, but now he actually joins me on the floor. So, how happy he is about that. Otherwise, having a chair that is supportive, but ideally not reclining for 3 hours. It's like going to bed early. Your back muscles are doing nothing. And if my son is viewing this, because every time we FaceTime, he's just always slouching on the sofa. And I love you dearly, John, but it drives me crazy when I see him, I guess, lose the benefit of sitting up tall. So sitting up tall would be the best way, or anything that's as close to that as possible.
Okay. I'm back. Okay. Well, we'll move into yoga. We'll talk about that. So there was quite a few yoga questions because there's a lot of yoga people out there. Are you familiar with the 12 yoga poses recommended by Dr. Fishman? It is a 20-minute routine that seems doable. What can you say about that?
Okay, been meaning to write something on that for years. So in a nutshell, I'll try to keep it short. Dr. Fishman is hypermobile. I think his heart's in the right place. I think by saying that rotational poses was what, showed an improvement in bone density. I don't think that's correct because most rotation happens in a thoracic spine, not in the lumbar spine. So there was never any evaluation of what was happening in the thoracic spine. So even if there was some positive changes in the lumbar spine, it doesn't make it safe. So that's one of my issues. The other issue is the hypermobility issue. He and most yoga practitioners are hypermobile, which basically means that their body goes, like most elbows would stop here, but when we're hypermobile, I do have some hypermobile joints, but people that practice yoga a lot, most of the joints are hypermobile. So when they say this is safe, it may be somewhat safe for individuals who are hypermobile, but translating that to somebody who is not hypermobile, I see huge, huge problems when teaching a yoga class and individuals trying to do what either myself is suggesting. Even if I suggest not doing that, they're looking around and they're trying all they can. But the body just wants to please, and if you don't have that motion to go into a deep rotation, you're going to get it from somewhere. And the path of least resistance is always people's spine. So I do have issues with it. Some of the poses that I'm totally against them being there. As well as one of my clients who went down to upstate New York to a retreat, and everybody was doing these poses and nobody even said, so who has a compression fracture? It was just like, let's go. We're learning them all, and they were not the modified poses. So I do have issues. Okay.
Okay. Let's go to, this is another yoga-related one. Is it okay to do forward splits if you have low bone density? Also, regarding the cobra pose, cobra yoga pose, is a full cobra okay, or is it best to stick with half cobra?
Okay, so two very different questions. The full split, if you have, again, the flexibility and you can go all the way out and hinge, I should do it sideways, but I don't know. Anyways, if you can hinge from your hips, whether you're in a wide pose or not a wide pose, it doesn't matter. So as long as you're hinging from your hips and you're keeping a neutral spine or a little lordosis in your back, it's safe. In regards to the full cobra, radiological studies have shown that not only can you get fractures of the front of the body, which is called a compression fracture, but you can get fractures of the spinous processes. They can actually be under so much duress and an extension pose that they can crack. So then those little muscles that I talked about earlier, connecting one to the other and connecting that to the side wings, they're going to get pissed off too. So I go, what is the benefit of doing a full cobra? Not much. Doing, baby cobra or sphinx, you're going to get just as much of the range of motion that's going to keep your spine happy and healthy, and you don't need to go into a full cobra.
Good. Margaret, the next question would be, I'm 65-year-old postmenopausal for 20 years. Can I rebuild bone via exercise?
Okay, so that's telling me you hit menopause at 45, which is very young. Most people will hit menopause at 50. The number of years that you are with hormones is very protective. And in one of the study articles I was reading, they were saying that you should really count the aging process of your body and your bones as, for women, the time at which you hit menopause, because that is when you are now dealing with life without hormones, and the clock's already ticking on the influence of loss of estrogen. So we know that in the first 7 to 10 years, you're dropping down quite a bit. Now you're 20 years post, so now you're leveling out. Can you build bone? You can stop the gradual decline. And if you are still healthy enough and your bone quality is good enough, and you could certainly lift to show some small increments in bone. Even with the Belinda Beck study where people were lifting very heavy, they were gaining like 1.3, and not everybody in that study gained. So that's the average. Sometimes people don't gain because they don't have the nutritional support or whatever, for whatever reason, they don't have the right genetics. So because the study shows that bone density can change, it doesn't mean it's going to change for everybody. So yes, you can, under the right conditions.
There's been quite a few questions came in on heel drops, Margaret. So heel drops being one of the exercises, and heel drops. So maybe you can throw some color on heel drops versus walking, and heel drops and a mild SI instability, and heel drops with a hip replacement. So there's variations on it. So people do it, and I think they find it some issues associated with it. So maybe you can throw some color on that.
So certainly, if you're doing heel drops, I'm assuming you're not walking outside. If you're going for a brisk walk, you certainly don't need to be doing heel drops. They don't need, the heel drops were things I would tell my mom to do. If it was a snowy day and I didn't want to walk outside because it was really icy, I'd say, Mom, at least do 50 to 100 heel drops today. Otherwise, heel drops should be practiced for most seniors because their fat pads on the bottom of their heel should be practiced with at least a yoga mat underfoot. Certainly not right on tile, maybe on hardwood floor would be fine. Depending, if you were used to walking around your house without shoes, your feet have adapted to that. If not, if you're always wearing shoes, then you would certainly want to do your heel drops with shoes. The gentle heel drop that I showed, it was a modified Qigong move. We'll put that in the description box. And that's a really lovely modified heel drop. So I would recommend that one over some of the rougher heel drops, which basically are just going up and dropping down on your heels. For the, I know she was a physio because she mentioned it, the physio with the unstable SI joint, I would say be sure that you are activating your deep abdominals, contracting your pelvic floor, so you take your breath in. Make sure everything's really tight as you drop down, because you want that stability both of the pelvic floor, which is going to support you from the inside, and the obturator internus is buffering the internal aspect of your SI joint, and then the outside just providing the extra stability. So yeah. And hip replacement. So yes, if you have the green light to walk briskly and run and do all the things that people with hip replacements do, you could do heel drops.
Right. So we'll stay on the exercise theme because there was a lot of questions about exercise specific things, and someone asked about hops. Are the hops better than jumps to stimulate bones? Like basically more intensity. Is there any more intensity in one over the other?
Yeah. So a jump, by definition, both legs are landing at the same time. Whereas in a hop, only one leg lands on the ground. Think of hopscotch. And so if you have only one leg landing, you have twice the amount of loading on that hip. So you always want to progress gradually. It's so very important. And so you would look at some studies, one of them that Can You Build Bone? I think we called that blog Can You Reverse Osteoporosis? Which I do cover one of the jumping studies, and they just incorporated 50 jumps, so double leg gradually, and then they started over time, so they progressed this over months of jumping off of a 4-inch height and off of an 8-inch height, and then gradually jumping with a weighted vest. So those are all progressions, just as you would progress from jumping, and any of those you could progress to, where you go, okay, now I'm ready to hop. Now, in some studies, they go right into it, but I like slow progression to make sure everything's happy, because when you go from jumping on 2 feet to hopping on 1, you need so much more stability in the hip joint. And so please, when you're jumping or hopping, look at your knees and be sure that just as if you were squatting, you would want to see your knees pointing where your toes are. If you jump, you want the same thing. And if you hop, you also want the same thing. So you don't want to be jumping and seeing this happening with your knees coming towards one another. So really important, because otherwise your hips will start to complain, your knees will start to complain. You'll go, I don't want to exercise anymore because it's causing too many problems. I hear it all the time. I have knee pain, I can't do it. And it's mostly because the form is not correct. Okay.
Okay, do you want to take a little break and I'll bring people through the resources? Do you need a pause there, Margaret?
Sure.
Okay, so I'll
I'll
put you aside if you don't mind, give you a bit of a breather. Okay. And I'll come in and I'll question for her. So, Margaret, if you don't
Thanks,
mind,
Richard.
we'll go forward to the next question. And okay, this is actually, I see this quite often, and it's related to the Liftmore study, Margaret. So, the Liftmore being the one out of Australia, and you
Yep.
referenced Brenda Beck's. Okay, how much weight can I lift? Well, how much weight do I lift is needed to actually build bone? And I think they have some concerns
Okay.
about the amount that they're putting on. So this is, maybe you can throw some color on
Yeah, so
that.
I can never tell you you need to do 3 pounds or 30 pounds. It's dependent on your body and where you're starting from. So if your goal is to lift to 5 repetitions, I mean, if you really, really push hard, you could probably go to 6 or 7, but by the 5th one, if you're doing an overhead press and you're like 4, 5, and if under trainer's guidance you make it, come on, but you go, that was really hard. That might, for some people, that's the weight of your arms. I've had young women just start with the weight of their arms. And for other people, it's 20 pounds. So, and there's lots of, 1 and 1.5 pound increments or half-pound increments in between that. So it's dependent on what your body's capabilities are, where you're starting from, what past injuries you've had. So it's the number of repetitions that you're looking at more than the number of pounds. So always safer to start really light with as little weight as possible. You go, wow, I can actually do 15 repetitions, almost 20 repetitions. You know you have to do more weight. So you go and you get more weight. You try it with heavier weight until you get to a point and you just keep jotting it down. You go, I did squats, really good form, could breathe through it, or do overhead lifts, all good. And you're going, I did 10 pounds. Then you go, but I made it to 12 repetitions. So then you go, okay, I'm going to try, to 2 more pounds. I'll do it with 12 pounds. Wow, between 8 and 10 repetitions, it was really hard. Well, if you're following the strength training guidelines through the National Strength and Conditioning Association or the American College of Sports Medicine, between 8 and 12 reps is sufficient for strength training. But we know the closer you can get to powerlifting, which is in the 5 rep range, or the heavier range, you can stimulate more, a little bit, but you have to do that under guidance because there is that risk factor I talked about. Okay.
So I think people are indicating they might not be able to hear me. So I'll just ask the audience, I'm back on.
Your mic is off.
It is?
Yep, on the screen I see a little
Okay,
mic
that's
off.
why it's not working. Okay.
Okay. You can come and stand beside me.
Okay. Well, I'll have to, but I have to read the question.
Or you could bring the laptop with it.
Okay,
with you.
then it'll be kind of weird. So I'm just going to read it out. I'm going to get off and I'll read it.
Okay.
Okay, and so you'll have to work it for people.
But
So-
if they, oh, you're going to read
okay,
it to
I'm
me.
going to read
and
it
then-
to you, okay, and then you're going to have to mouth it back to people.
Or read it loud, and I'll come and stand beside you. Go.
Margaret,
Go,
okay.
go. Just go.
Are planks as good as 4Ms for strengthening my back? Just
Oh,
over there.
okay. So, great question. In regards to planks, they're not really strengthening your back directly. When you do a plank, it's strengthening your transverse abdominis muscle. Your transverse abdominis muscle does wrap around and attach into the fascia of your back, but your plank is mainly strengthening the anterior part of your body. So I think they can see, Richard? I don't know. Okay. So in the plank, that's the anterior part of your body. So that's why in strengthening your core, I want you to also do side planks where you're doing a 45-degree angle and a 90-degree angle. So you're getting all the aspects of your transverse abdominis, because just doing a straight plank is not sufficient. But it's not going to strengthen your paraspinal muscles. It is going to provide an internal corset to help stabilize your back. I hope that helps you.
Okay, I'll ask the next question.
Just bring everything closer, hun, so that...
What types of exercises do we avoid if we have osteoporosis?
Okay, what type of exercises do we avoid if we have osteoporosis? You can set things up over here, be flexible, and move things over towards me while I answer that question. Okay, so when it comes to osteoporosis, a hallmark study in the 80s showed us that if women did exercises, and you can look it up, Mayo Clinic, Dr. Sinaki, 1984, and these flexion exercises, which I'm comfortable to do because I know what the quality and density of my bone is, but done, and I don't do many except when I'm demonstrating, but these types of exercises, toe touches, crunches, for women who had back pain or had a compression fracture, with those who did those types of exercises over a course of 2 years, 89% of them sustained either a new or worsening compression fracture. Whereas the group that did the opposite motion, the motion I keep encouraging you all to do, which is going into gentle extension from the floor through, just sitting tall, standing tall, incorporating back muscles through all of your, activities of daily living, that group only sustained 13% of them had a compression fracture. So it was very, very protective. And even all the data today is showing that the more we can strengthen our paraspinal muscles, so the more extension motion, the better. So what other motions are harmful or potentially stressful on the back? There's a number of them. One of them is the Superman, which is why I suggest not doing it when you're doing arms and legs, so both, and your tummy's straight on the floor, because there's a lot of hyperextension of the back. And Stuart McGill and his studies showed it was very compressive. It was like 600 newtons of force in the spine itself. So sometimes we're worried about the actual position of the spine in terms of the loading, but sometimes we worry about the amount of pressure that's created within a disc. And so the disc is a soft material that's the cushioning between two vertebrae. And if that disc pressure increases significantly in movements such as, you see another one that I did a YouTube on, is avoid this. And so many people are teaching these arm lifts when you're doing your squats. They call them air squats, I believe. Makes zero sense to me, but you can watch my YouTube video on it as to why. Those types of things, taking something heavy and lifting it away from you, it just increases the intradiscal pressure. Sitting on a chair and putting down a heavy weight, huge increase in intradiscal pressure. So There's our other motions. Rotation changes the forces in and around the vertebrae, even after you've only had one compression. So if you're going to rotate, just always take good body mechanics, whether you have or worried about compression fractures or not, because this is super important for protecting your disc as well. So you'll see all good athletes, they move with their hips, they move with their legs, and so it's rare that you'll see them break down their core. They're, developing the strong core helps you to keep the pelvic girdle and shoulder girdle, so your oblique abdominals are like this, and so we're keeping everything tight and strong together. I hope that helped.
Good. Walking. For building bone, would multiple short walks throughout the day be better than one long walk?
Oh, great question. Walking, regarding do I take one long walk or multiple short walks? Much better to do shorter walks. You don't have to, do like 10 short walks, but certainly if you're going to have 40 minutes to devote for walking, I'd much rather see you do 2 20-minute walks, both for cardiovascular benefit, and as well, in that 20 minutes, you're going to have an easier time going at the pace that you need to stimulate bone. And your mesenchymal stem cells, the little stem cells that are being born every day, they need stimulus. But if you give them lots of stimulus all at once, they kind of they don't need it. It's like, you having a double meal all at once. It's not going to help you feel satiated for the rest of your day. So if you satiate your bone cells by having, some activity every 3 to 5 hours, they're going to be more robust. And so I hope that helps.
Okay, this is a general exercise question. How do we make sure we're doing the exercises correctly? Hard to tell by watching a video with no one to correct me.
So really good question about how to ensure that you're doing exercises safely. And this is really critical, especially for those of you that are hypermobile, again, that have too much mobility. And so I would watch the video and try not to either pause it and look at yourself in the mirror and going, how am I executing this exercise? Look at yourself facing forward, look at yourself facing sideways and go, what does it look like? If you still are unsure how you're performing with an exercise, ask a friend, ask a family member to videotape you. So you can look at yourself and you can critique yourself. It's been really helpful for me to do all these YouTube videos, and I realized, oh my gosh, I'm hyperextending my elbow all the time because I don't feel it. Just like I would do my knee and not feel it. So using the feedback of a mirror, of others, of devices to record is all very helpful.
Medications.
Okay,
stopping Prolia. Is it okay to stop after one shot?
Okay, questions on stopping Prolia and stopping after one shot. Having spoken to Dr. Rodriguez, who was the primary author in the paper on the multiple compression fractures that were being found out in 2017, 16. I asked her exactly that question at a conference, and she said, after one, it's okay to stop, because they had not seen the effect of multiple compression fractures after one. There was a theory out in terms of what happens with stopping Prolia, and so it's safe with only one, and we have a blog that's coming out shortly that's being updated on stopping Prolia that will explain that theory in more detail. But yes, after one, we're okay. But I have to say, if you were put on Prolia, there's a reason you were put on Prolia. So talk to your doctor. Don't just stop because people on Facebook are telling you, oh, you shouldn't be on it. I'm sorry, but if you're 82 and you're being told to be put on Prolia, there's probably a very good reason, and you're probably going to be on it for life. Now, if you're 52, I would worry that you're being suggested Prolia, but at the same time, you need to then have a conversation with your doctor and say, I'm really uncomfortable with this choice. What other options do I have? But I wouldn't just stop and walk away from your healthcare professional.
Okay. Do you want one more medication on reclass? So person asks, reclass injections recommended to delay second infusion after fracture from a ski accident. When should I have a third infusion?
So this is, hopefully you heard that question on reclass, and so the half-life on reclass is very long. I hear it's 10 years. So that reclass injection is with you for a long time. And if you were told that you can delay to help your bone to heal, totally agree, and you could delay it probably even several months. What would be safe to do would be to have a bone marker test. We recently put a YouTube out on bone markers, and what the bone marker test would allow you to know is, did the reclass A do its job of slowing down your osteoclastic activity, the osteoclasts being the cleaners and cutters of bones, and by being off of it, an extra 2 months, 6 months, has the activity changed? Maybe you don't need another injection for a longer period of time than the 2 months if your bone markers are indicating that that first injection is doing its job. But when that starts to change, if the bone marker test says, oh, those osteoclasts are getting, more active and we need to keep you protected, then that's definitely an indicator that it would be time for another infusion.
A number of questions about calcium and calcium supplements in particular.
Okay, so when it comes to calcium supplements, for the last 4 or 5 years at least here in Canada, all the specialists have been saying try to get it from food. They're recognizing that a supplement onto itself is not sufficient. It's all the micronutrients that come with the foods that have calcium, all including in dairy products protein. And we know that protein is so critical for our bones. There are a lot of calcium companies that pry on the fears of individuals. I would stay away from algae sources of calcium because unfortunately our oceans are polluted, and so you are ingesting some of those pollutants, and it's been shown through testing through consumer labs that some very popular algae companies are not passing purity standard tests. So a couple of years ago when I started, I consulted with somebody doing her PhD on nutrition and osteoporosis, and she said, Margaret, calcium citrate, the body recognizes it, it knows it. You don't have to take it with meals, especially as people get older. They don't have as much stomach acid, so it's a really good source of calcium. Get it in 250 or 300 milligram capsules. Take it on days when you feel like you have not had enough calcium. If you're going to supplement your calcium, or if you're really being mindful of having enough calcium, be sure that you have enough magnesium. There are so many people that contact me or that I know in society these days that have depression and have anxiety. And those are 2 common symptoms of magnesium deficiency. If you ingest calcium and you don't follow up with half as much magnesium, so if you're having 1,000 milligrams of your calcium, you want to have 500 milligrams of magnesium. Without that, if you're saying here, you're creating a larger insufficiency or void of magnesium and creating more issues. Constipation is another issue with low magnesium levels. So there's like 400 different symptoms that are accompany that.
Okay. A lot of questions about vibration therapy, but this one in particular. To maximize the benefits of the Maridine LIV, how should I schedule my workouts, i.e. a number of hours before and after the Maridine session?
Okay. So a question in regards to scheduling the use of the Maridine, and we're only taking one question on the Maridine because we're going to have a live stream with Clinton Rubin again in the fall. But just like I spoke in terms of walking, the reason for the Maridine being to stimulate the baby bone cells and mesenchymal stem cells, you want to break that up between 3 and 5 hours. So first thing in the morning, if you can get on your vibration platform, before you go to bed, get on the vibration platform, do your workouts in between. If you don't have time for a workout and you can get on the vibration platform even a third time, it's not going to hurt you. And it's really nice knowing that the vibration platform is taking care of stimulating your bones, and then you can take care of all the other important parts of fitness that you need to do, because the Meradyne doesn't do anything for your arms. So do some great loading for your arms, do some upper body strengthening, strengthen your spinal muscles for both posture and protecting you from vertebral compression fractures, work on your balance. So many other things that you could work on, but no, with or without, to break up when you exercise or stand on the platform.
Okay, so last question, you ready?
Okay, we have 4 more minutes.
Okay, you sure? Okay,
Yeah.
so
One more question.
One more question
And
before
then-
the last question. Okay, would love your advice on regarding long flights. People taking 10-hour or more flights with severe low bone density in the spine, particularly.
Okay, so ideally with low bone density of the spine and long flights, if you could afford it, I'd say get a seat that you could lie down, but that's business class. So if that's not possible, then keep your spine as safe as possible there are great, I hate the ones that pull, that look like a life buoy, that come around. Don't use those. Nothing that's going to put you in this position. You want to create the seat behind you with a little lumbar lordosis, because all the seats push me in the wrong place, and I'm 5'2". So depending on how tall you are, you want to make that seat, bring different size sweaters, sweatshirts, things that you can put behind you or around you. That'd be one thing. Using a neck support that I totally love, and I'm trying to remember the name of it right now, but it's kind of a hard plastic, and then it wraps around your neck. It's also available on Amazon. That will keep your neck in this position so that when you fall asleep, your neck's not falling, and then the 11 pounds is pulling the rest of your spine. And then use whatever bags that you brought and rest your arms. So again, so that the weight of your arms isn't also pulling you down as time progresses. Take an aisle seat so you can get up frequently and you're not having to squirm and rotate to get through the other passenger. Especially after sitting for long periods of time, it's so compressive. Be very cautious removing your bag, and most people are more than happy to help. So, don't hesitate to ask somebody to help you remove something from an overhead bin. And if possible, throughout the flight, just, I like doing lots of butt squeezes. I like doing pelvic tilts, shifts. Make sure you're wearing compression socks, obviously, and doing ankle pumps to avoid deep vein thrombosis, that kind of thing. Okay.
Last question?
Okay, last question,
Okay.
yes.
What made, can they hear me?
Yeah, a minute and a half. Go ahead.
Can you hear me?
Yes.
No. Okay, good. Well, what made you choose to work with people who have osteoporosis, Margaret?
I chose to work with people with osteoporosis because most of the time, by the time they have osteoporosis, they have so many other issues as well. And so it just as my clientele got older, they had other issues coming up, and I was realizing that the resources for individuals with osteoporosis were not what I would recommend, because when I started this 15 years ago, people were not recommending that people lift very heavy. They were not recommending, the safe activities of daily living throughout. So it evolved, both from geographically living in a country in Canada where over the winter months I didn't feel it was safe for them to travel. And also that I had worked in so many areas of physical therapy, stroke, spinal cord, neurology, so many different ones. I went, wow, everybody has a skeleton. And, even though I was helping them through their musculoskeletal problem, I was never addressing their skeleton, and realized that we needed to spend more time teaching people about their skeleton. And so I thought that was something that I wanted to take on as a challenge. And then Richard said, you have any ideas of things that you'd like to work on. And I thought this would be really great. And I remember years ago in Silicon Valley, and Richard was at Apple, and I was photocopying exercises that were like 40 years old, and I went, I can't believe physical therapy is still being practiced like this in the heart of technology, Silicon Valley, California, and then there needs to be a better way, and so Richard has helped it be a better way. So it's exciting. So I want to thank you all for tuning in, for making time in your day, for taking care of yourselves. I recognize there's so much on our site, and I'm excited that it will be more accessible to you soon. And just wish you a wonderful summer if I don't see you again this summer. But we will have another live stream in a month, and it'll have a very special guest, which will be my daughter. So, all right, take care, stay safe, be well.